Good morning, friends. When somebody has got erectile dysfunction and he is thinking of penile implant surgery, patients are usually very scared. And I do not blame them. Whenever somebody gets the thought of having surgery, they're always scared. There are some questions which the patients have in their mind when they're undergoing penile implant surgery, and they're always scared about these questions. So today I will discuss about these common questions which the patients have in their mind regarding penile implant surgery and why they feel that penile implant surgery is dangerous. I am Dr. Ashish Sabharwal, urologist, andrologist and robotic prostate surgeon in New Delhi, India. I will tell you about penile implant surgery and its complications. First thing, is penile implant surgery painful? So penile implant surgery is not painful. Usually after 1 or 2 days the severe pain gets reduced and we give oral pain medications to control the pain. Some pain stays for about 2 to 4 weeks. After 2 to 4 weeks the pain is absolutely negligible and patients are very comfortable. So you do not have to worry about the pain. Second thing is risk of infection. Penile implant is a foreign body. If any foreign body is put inside the body, there is always a chance of infection. If you put a hip implant or a knee implant, there is always risk of infection. Similarly, if you put a penile implant also, there is risk of infection. The risk of infection is about 1 to 3%. That is why it is always important to go to an experienced penile implant surgeon, because they will be able to identify the infection soon and treat it. Secondly, people who are doing the penile implant surgery regularly, they have a lower chance of infection as compared to doctors who are doing maybe 1 or 2 implants a month. So always go to somebody who is a penile implant specialist and doing penile implant surgery regularly. For my patients, I always give them a protocol of antibiotic and betadine scrub bath, which they have to start 3 days before the implant surgery. And because of that, at the time of implant surgery, they are totally sterilized and the risk of infection is very less. Third is the mechanical failure and the implant life. Many patients ask me how long the implant will last. So it is straightforward. After 5 years, 95% of the implants will be working. After 10 years, 85% of the implants will be working. And after 15 years, about 75 to 80% of the implants will be working. And the risk of mechanical failure is higher in a 3-piece implant because it has multiple parts, the 2 cylinders, the retropubic reservoir and the scrotal pump. So when there are more parts, there are chances of mechanical failure which are higher. But in the malleable implant, if you see, it is a single rod. 2 rods are placed in the penis. When you want to have sex, make the penis straight and have sex, and after having sex, put it down. So there is no mechanical part which can get spoiled. It has a longer life as compared to a 3-piece inflatable implant, and most of the malleable implants stay for more than 15 years. Injury to the adjacent structures. So we place the implant in the corporal bodies. The urethra is very near to that, and also the blood vessels are very near to that. So there can be injury to the urethra, injury to the blood vessels. But this is very, very rare, and doctors who are experienced in penile surgery, these type of complications are not seen in their surgery. Will the length of the penis stay the same or reduce after the implant? The penile length after the implant will stay the same as it was before the implant. Some patients say that after implant surgery, my penile length has reduced. You have to understand that if you don't use it, then penis atrophies. So your length after the implant will not be what the length of the penis was when you were 30 years younger. The penile length will be what it was immediately before the implant surgery. The last thing which you should know about penile implant is that penile implant surgery is irreversible. What that means is that if the implant goes bad and you have to remove the implant for some reason, the only way to regain erection is to put a new implant in. You cannot remove the implant and start using medicines for your erections. So penile implant surgery is irreversible. Only when other things are not working and you have made up your mind to go for implant surgery, only then you should go for the implant surgery. I hope I have answered many of your questions. Thank you for listening to my video. And if you want to know more about penile implant surgery, you can visit my YouTube channel. Also, my email and WhatsApp number are there in the description. If you want to contact me, you can contact me through my email or WhatsApp. Thank you for watching my video.